So our first one is we have a patient treated in the emergency department for shock of unknown etiology. The first action by the nurse should be to check the blood pressure, obtain an O2 sat, attach a cardiac monitor, check level of consciousness. Just what we were talking about. Okay, 33% said blood pressure, 47% said O2 sat, 20% said level of consciousness. So what did we talk about when we talked about how we prioritize based on ABCs, right? So what do we need to check first? O2 sat, because what's our underlying problem with all types of shock? Lack of oxygen, lack of perfusion. So getting that baseline oxygen saturation, obviously, you know, in real life, we're kind of doing everything all at once. But again, what the NCLEX wants you to do is say, okay, if you're the only person there and you can only do one thing at a time, what are you going to do first? And that would be find out how their breathing is, the airway, breathing, circulation. We really don't care that much about level of consciousness at this point. We want to make sure they're breathing and they have a heartbeat. Those are our priorities. We have a diabetic patient, vomiting, diarrhea, times 3 days, glucose is 748, blood pressure is 72/62, pulse 128 and irregular, and thready. Respiration is 38, temp 97, disoriented, lethargic, cold, clammy skin, cyanosis of the hands and the feet. The patient is experiencing the progressive stage of septic shock, the compensatory stage of diabetic shock, the refractory stage of cardiogenic shock, the progressive stage of hypovolemic shock. Oh, I love when this happens. Okay, 33% said progressive septic, 24% said compensatory diabetic, 19% said refractory cardiogenic, and 24% said progressive hypovolemic. So let me get rid of these lines here. So this is a very common NCLEX style question. And you can approach it two different ways. What you can do is you can say, okay, I'm going to decide what stage of shock they're in, and do the process of elimination that way. Or I'm going to say, what type of shock could they be in based on the clinical picture, and do my process of elimination that way. So let's start with the clinical picture and the type of shock. Is there anything in that picture that tells you that they're in septic shock? Yeah. What? But what about the rest of the clinical picture? Is there any indication of infection? No. Or in some of the underlying causes of septic shock? So chances are the patients, you know, based on the data that you have there, there's nothing that indicates septic shock, right? Or sepsis, or any underlying problems that could cause sepsis. Okay, let's go diabetic shock. Was diabetic shock a type of shock that we discussed? No. So we can eliminate that. How about cardiogenic? Is there anything in that picture that talks about the signs and symptoms or the conditions that would lead to cardiogenic shock? Yeah, blood pressure is going to be 72, you know, in all types of shock you're going to get that low blood pressure, the worse they get. Same thing with the heart rate, same thing. There's nothing in there that talks about chest pain, MI, crackles in the lungs, elevated central venous pressure. All those things that we talked about were kind of different about cardiogenic. So there's nothing in that picture that talks about cardiogenic shock or cardiac issues, other than the cardiac issues that just come with all kinds of shock. What about hypovolemic? Is there anything in that picture that talks about that would lead you to think that maybe the patient is dehydrated? The vomiting and diarrhea for 3 days. So that's one way that you can answer the question, is to eliminate the types of shock that don't fit the clinical picture. Or you can look at the clinical picture, the vital signs and everything else, and say, okay, would these vital signs indicate the progressive or non-compensatory phase? Really severe. Are they compensating or are they decompensating? They're decompensated. They're in the progressive or decompensated phase of shock, because if they were compensating, their blood pressure would be better, they wouldn't be disoriented and lethargic, they wouldn't have cyanosis of the hands and feet, because they'd be compensating. So you can eliminate anything that talks about compensation, because that is one sick puppy on their way down to the final stage of shock with vital signs like that. But are they in the refractory stage? Can we bring them back? Probably. Refractory stage means he's going to die no matter what we do. That's the final stage. So we're in the progressive stage, and then we have to determine, okay, are we progressive of septic, or are we progressive stage of hypovolemic? So there's two ways you can approach these types of questions. Figure out what stage they're in, or figure out what type of shock they're in. And then do your process of elimination and figure out. So the correct is he's in the progressive stage of hypovolemic shock. The patient with hypovolemic shock has a urinary output of 15 milliliters an hour. The nurse understands that the compensatory physiologic mechanism that leads to altered urinary output is activation of the sympathetic nervous system causing vasodilation of the renal arteries, stimulation of cardiac B adrenergic receptors leading to increased cardiac output, release of aldosterone and antidiuretic hormone which causes sodium and water retention, movement of interstitial fluid to the intravascular space increasing renal blood flow. A lot of words in that. So the majority, 82%, said release of aldosterone and ADH. Because that is what they're asking you, is what is the compensatory physiologic mechanism leading to the altered urinary output? And that would be the increased secretion of ADH, so the patient retains sodium and water and increases their blood volume and decreases their urinary output. The patient's involved in a motor vehicle accident, admitted to the ED with cool, clammy skin, tachycardia, and hypotension. All of these orders are written. Which one will the nurse act on first? Insert 2 14-gauge IV catheters, administer oxygen at 100% per non-rebreather mask, place the patient on continuous cardiac monitor, draw blood to type and cross-match for transfusions. Yay, 100% said administer oxygen. Because again, you're prioritizing based on ABCs, airway first, then breathing, then circulation, which would be your 2 large bore IV catheters and your cardiac monitoring. The patient in septic shock has not responded to fluid resuscitation, as evidenced by a decreasing BP and cardiac output. The nurse anticipates the administration of nitroglycerin, Tridil, dobutamine, Dobutrix, norepinephrine, Levofed, sodium nitroprusside, Nipride. So some of you wanted to give either Tridil, nitroglycerin, or Dobutrex. Nobody wanted to give Nipride. The majority of you wanted to give Levofed. Why is that? What about nitroglycerin? What is that going to do? Vasodilator, and it's going to, what it's going to do to the blood pressure? It's going to decrease the blood pressure. So Dobutrex, what is that? That's a positive inotrope. It improves cardiac contraction, but what does it do to the blood vessels? Relaxes them, lowering the blood pressure. So the one that we're going to give for the majority of patients in septic shock is going to be a vasopressor, norepinephrine levofed. The client admitted with septic shock develops tachycardia and an increase of 20 millimeters of mercury in systolic blood pressure. Which pathophysiologic factors of hyperdynamic shock are responsible for these clinical manifestations? The inflammatory reaction of circulating endotoxins, vasoconstriction resulting in tissue hypoxia, reductions in H&H, or platelet aggregation. The 45% said inflammatory reaction of endotoxins, 35% said vasoconstriction, 5% reductions in H&H, 15 platelet aggregation. So we've got an increase in systolic blood pressure. So in that hyperdynamic phase of septic shock that we talked about, we're going to have the tachycardia and the bounding pulses, because the first inflammatory reaction is going to be some vasodilation and heat and, the bounding pulses, the warm, moist skin, as the body is trying to counteract the effects of that bacteria that's causing their inflammatory process. Once those endotoxins cause capillary damage and we start having capillary leak, then that blood pressure is going to start to go down. So it's the inflammatory reaction of the endotoxins. The client has all of the following clinical manifestations. Which assessment finding alerts the nurse to the probability of septic shock? Hypotension, pale clammy skin, anxiety and confusion, oozing of blood at the IV site. Okay, 50% said oozing of blood, 25% said pale clammy skin, and the rest said anxiety and confusion or hypotension. This particular type of NCLEX question is asking you to do what? What is different and unique about septic shock that's different from all the other types of shock? Because what it's saying is that the patient has, is going into shock. What is it that's making the nurse think that it's septic shock versus some other type of shock? So with all the other types of shock, you're going to see hypotension, you're going to see pale clammy skin, and you're going to see anxiety and confusion. But it's only with septic shock that can cause DIC that has the oozing of the blood at the IV sites. So when you're reading this type of NCLEX question, look at it like, okay, they're trying to get me to figure, to say what's different about this type versus that one. And so in this case, septic shock is oozing of blood because you're going to have that complication of DIC. The client is in the hyperdynamic phase of septic shock, has been admitted to the ICU. Which complication will the nurse be alert as shock progresses from the hyper to the hypodynamic phase? ARDS, bowel obstruction, VTAC, or seizures? So 84% picked ARDS. Why did 84% of you pick ARDS?
That's the number one effect of
Right, when you were in the hypodynamic phase, what's happening to your capillaries? They're leaking. And remember way back when we talked in respiratory, one of the reasons that you get ARDS is because of a systemic inflammatory response where the capillary alveolar membrane becomes permeable and fluid leaks in and they get ARDS. So that's remembering that, the SIRS, septic shock, ARDS, one of the most common complications of septic shock is going to be ARDS. While assessing the client at risk for shock, the nurse finds the systolic pressure to be 20 millimeters lower than baseline. What is your priority intervention? Increase the IV, administer oxygen, call the doctor, document the finding. Okay, 14% wanted to increase the IV, 52% wanted to give O2, 33% wanted to call the physician. So you're monitoring your patient, they've got, things that are going on that could lead to them going into shock, and now you notice a drop in their systolic blood pressure. So it's going to be a drop in mean arterial pressure. What's your priority intervention? Oxygen, because the cells aren't getting enough oxygen. Then you're probably going to increase the IV rate, and then you're probably going to call the physician and then document. But the first thing you're going to do is to improve their airway, their oxygenation. The older client recovering from septic shock is preparing for discharge home. Which information will the nurse include in the teaching plan for this client? Clean your toothbrush daily, avoid using antimicrobial soaps, wash your hands after changing the litter box, bathe your groin, armpits, and genital areas once daily. Okay, 8% said clean the toothbrush, 54% said wash your hands after changing the litter box, 38% said bathe groin, armpits, and genital areas once daily. So, why did 54% of you get this question wrong? Why did 8% of you get it right? Okay. Patients that are recovering from septic shock should not be changing the litter box at all. Why? Right, toxoplasmosis. So they shouldn't even be emptying the litter box. And if they were, they're going to be at more risk for inhaling the bacteria and getting problems or the spores. So washing their hands, obviously would be important. So anyway, they shouldn't be changing the litter box. So you should be telling them to clean their toothbrush every day. Why is cleaning the toothbrush important? A lot of bacteria accumulates on toothbrushes. I'm sure if you did a swab of the toothbrush, you would be just totally disgusted by what is growing on there. But if you clean that toothbrush with an antiseptic mouthwash or some other antiseptic, why is that good? Why is that going to be helpful for this particular patient? What can happen if they have a lot of bacteria on their toothbrush? If they have bleeding gums, then they're going to get the bacteria into their bloodstream. They could get bacterial endocarditis. They could get sepsis again. So they shouldn't be changing the litter box, and they should be cleaning their toothbrush. The nurse recognizes that which client is the highest risk for septic shock? 12-year-old with an open fracture of the left femur and 2 peripheral IVs, 35-year-old with HIV receiving enteral feedings via a PEG tube, 65-year-old with pneumonia receiving IV fluids and broad-spectrum oral antibiotics, or an 82-year-old with leukemia receiving broad-spectrum IV antibiotics via triple lumen central line. Okay, 24% said the 12-year-old, 19 said the HIV, 10% said the pneumonia, and 48% picked the 82-year-old. Why is she the highest risk? Immunocompromised and has a central line, which is one of the primary causes of sepsis, which is why your patients have those things pulled as soon as they don't need them anymore. Just like with Foley catheters now. Everything comes out if they don't need it anymore. On discharge after undergoing an exploratory laparotomy, the nurse teaches the client to monitor for which sign of the onset of shock: decreased urine output, low body temperature, slow bounding pulse, constipation. Okay, 52% said decreased urine output, 19% said slow bounding pulse, 24% said constipation. What would be the first sign of shock that a patient might notice? But would that be would low body temperature tell you that you're going into shock? Would a slow bounding pulse tell you that you're going into shock? Because what happens to your heart rate when you go into shock? Increases. But decreased urinary output the patient might notice. Again, that compensatory mechanism that the body is trying to retain fluid so that it can bring more oxygen into the bloodstream and to the tissues. So decreased urine output would be something that you could talk to them about as they're being discharged. The ICU patient is delirious and exhibiting significant signs of anxiety. This patient has a heightened risk of having what nursing diagnosis? Risk for aspiration, risk for impaired skin integrity, risk for injury, risk for imbalanced body temperature. Okay, 11% said aspiration, 5 skin integrity, 79% risk for injury. Why are they at a high risk for injury? Because they're delirious and anxious. They're not really at a risk for aspiration. So using your ABCs in this situation would not be appropriate, because there's nothing in this that's talking about aspiration or airway issues. The nurse notes the patient's serum lactic acid level is trending upward. What interpretation should the nurse draw from this assessment finding? The patient is experiencing increased intracranial pressure. Intracellular contents are being released into the vascular space. The patient has developed a systemic infection. The patient is experiencing a deficit in oxygen supply. And 94% said experiencing a deficit in oxygen supply. Why did you all answer that? Right, because if they have a deficit in oxygen, they've switched to anaerobic metabolism, lactic acid levels rise. And finally, the nurse notes that the cardiac output, systolic blood pressure, and pulse pressure are beginning to decrease rapidly in the client being treated for septic shock. Which conclusion can the nurse draw from these changes? Respiratory acidosis will follow quickly. Compensatory mechanisms are being activated. The client is in the hypodynamic phase of septic shock. The therapy for septic shock is beginning to demonstrate effectiveness. Okay, 10% said acidosis or compensatory mechanisms being activated. 76% said the hypodynamic phase of septic shock, which is correct. 5% said the therapy is beginning to demonstrate effectiveness. What's happening to this patient? Are they getting better or worse? Worse. So therapy's not working. compensatory mechanisms were already activated, but now they're not working anymore because he's deteriorating. What type of acidosis is going to happen? Metabolic acidosis because of lactic acid levels. Okay.